heads for everyone. So shall we do that? Because I was thinking that we could bench.
But it's certainly true that findings we've had.
All of the projects in the programme all involve partnerships, so they involve first and foremost local social care and healthcare workers working in partnership with local older people, with families, with communities, with voluntary organisations, and of course health and social care organisations working in partnership with each other.
George, you've agreed to prepare a hot drink today as part of the observational occupational therapy assessment. Would you prefer to make...
MAST is an early intervention service for people with memory problems who wouldn't normally have had a service, in that they wouldn't meet the access criteria for the existing memory clinics. In addition to myself, we have a community mental health nurse, a clinical psychologist, a support worker who is seconded from the Alzheimer's Society, and a secretary.
Right, so for this next sub-test, what I'm going to do is just going to show you some pictures. Okay?
Yeah.
And what I'd like you to look for is the most important part of the picture that is missing. So each picture...
Well, I had an attack of meningitis last year and was in hospital for about a month, about which I remember nothing. But I did recover reasonably well, except that my memory, concentration and emotions were obviously affected. When I was driving back from a visit to the school I was at in mid-Sussex many years ago, I suddenly had a sort of breakdown and I had to pull the car in, and well, as I'm doing at the moment, sorry, getting rather emotional, and that never used to happen before. I was always rather a self-contained person.
It's a completely new service, so what we do differently to how services are set up at the moment is that we sit in primary care, and it targets people in the early stages. We can offer a lot of intervention and support at that early stage, when obviously there's a lot of fear around what people are facing. People are aware they've got these problems, but having them investigated is quite a frightening experience often.
Well, the assessment gave me an outside view and a rather more rational view, perhaps, of what I was going through, and that it was not abnormal. These things did happen.
At the right height for your
Problems with memory and problems with emotional health will actually rest in whether someone's physically well or not. So it's really all about screening for physical health and screening for emotional health. Just whether some simple strategies can help that person and their family stay at home, stay in control of their life, be in control of those things that are very familiar to them.
Just cast your mind back in terms of, was there one...
What we did have in Poole was very good relationships between Adult Social Services and the Primary Care Trust. So over a period of years, through some other projects, a good level of trust and relational working had been established. And in my view, that's absolutely critical if you're going to get some kind of integrated working.
I think we've all been involved in projects before which have perhaps had a fantastic start for the first year or so, but then the money's dried up. And we were determined with this project that that wouldn't happen. One of the key things has been able to evidence the difference that this partnership has made. So right from the outset, we needed to be very clear about what outcomes we were going to achieve for older people. Now that was a range of things, everything from reducing the number of emergency admissions to hospital, reducing the length of time people stayed in hospital, increasing the numbers of packages of intensive support at home. And we measured that every step of the way.
I mean, we know it's working on a very practical side because of the results that we've achieved. You know, the length of bed days that we've been able to save for the acute trust in getting people out of hospital sooner has been extremely impressive.
The POPs programme in Poole achieved a 27% reduction in bed days in Poole Hospital.
Were you happy with then?
We were very fortunate with our Commissioner in that they were prepared to move money around the system. And so within the last financial year, with the evidence base that we'd collected, they agreed in negotiation with the other NHS services that they were currently commissioning from, that we would shift a very significant sum of money, over £600,000 worth of money, from secondary care out into the community to sustain the POPs project.